What is IBS? Hey guys, welcome back to the channel, the #1 channel on YouTube. Hope you guys are doing well, and today we will be looking at what is IBS. We will be looking at everything in this video, so stick till the end to learn something new. Let's get straight into the video. IBS is also known as spastic colon, irritable colon, mucus colitis, and spastic colitis. It is a separate condition from inflammatory bowel disease and isn't related to other bowel conditions. IBS is a group of intestinal symptoms that typically occur together. The symptoms vary in severity and duration from person to person. However, they last at least 3 months for at least 3 days per month. IBS can cause intestinal damage in some cases. However, that is not common. IBS doesn't increase your risk of gastrointestinal cancers, but it can still have a significant effect on your life. Learn more about the specific ways IBS can affect your bowels. The symptoms of IBS typically include cramping, abdominal pain, bloating and gas, constipation, and diarrhea. It's not uncommon for people with IBS to have episodes of both constipation and diarrhea. Symptoms such as bloating and gas typically go away after you have a bowel movement. Symptoms of IBS aren't always persistent. They can resolve only to come back. However, some people do have continuous symptoms. Women may tend to have symptoms around the time of menstruation, or they may have more symptoms during this time. Menopausal women have fewer symptoms than women who are still menstruating. Some women have also reported that certain symptoms increase during pregnancy, whereas to men, symptoms of IBS are the same as the symptoms in women. However, a lot fewer men report their symptoms and seek treatment. IBS pain may feel like cramping. With this cramping, you will also have at least 2 of the following experiences: some relief of pain after a bowel movement, a change in how often you have a bowel movement, changes in the way your stools look. Your doctor may be able to diagnose IBS based on your symptoms. They may also take 1 or more of the following steps to rule out other possible causes of your symptoms. Have you adopt a certain diet or cut out specific food groups for a period to rule out any food allergies? Have a stool sample examined to rule out infection. Have blood tests done to check for anemia and rule out celiac disease. Perform a colonoscopy. A colonoscopy is typically only done if your doctor suspects that your symptoms are being caused by colitis, inflammatory bowel disease, or cancer. Learn more about the process of diagnosing IBS. For some people, dietary changes can go a long way in helping ease symptoms. Because the symptoms of IBS vary among people with the condition, approaches to dietary changes need to vary. There is no cure for IBS. Treatment is aimed at symptom relief. Initially, your doctor may have you make certain lifestyle changes. These home remedies are typically suggested before the use of medication. Learn more about the different types of IBS treatment. Managing your diet when you have IBS may take a little extra time, but is often worth the effort. modifying amounts or eliminating certain foods such as dairy, fried foods, indigestible sugars, and beans may help to reduce different symptoms. For some people, adding spices and herbs such as ginger, peppermint, and chamomile has helped to reduce some IBS symptoms. If your symptoms do not improve through home remedies, such as lifestyle or dietary changes, your doctor may suggest the use of medications. Different people can respond differently to the same medication, so you may need to work with your doctor to find the right medication for you. As with all medication, when considering new medication, it's important to tell your doctor what you are already taking, including herbal remedies and over-the-counter medications. This will help your doctor avoid any medication that could interact with what you are already taking. Some drugs are used to treat all symptoms of IBS, while other drugs are focused on specific symptoms. Drugs that are used include medications to control muscle spasms, anti-constipation drugs, tricyclic antidepressants to ease pain, and antibiotics. If your main IBS symptom is constipation, linaclotide and lubiprostone are two drugs that are recommended by the American College of Gastroenterology, or ACG. Although there are many ways to treat IBS, the exact cause of IBS is unknown. Possible causes include an overly sensitive colon or immune system. Post-infectious IBS is caused by a previous bacterial infection in the gastrointestinal tract. The varied possible causes make IBS difficult to prevent. The physical processes involved in IBS can also vary, but may consist of slowed or spastic movements of the colon, causing painful cramping, abnormal serotonin levels in the colon, affecting motility and bowel movements.
Researchers don't know for sure what causes IBS, but there are some theories about factors that could influence IBS symptoms, including acute infection or inflammation of the intestine, such as traveler's diarrhea, which may precede onset of IBS symptoms, physical and/or emotional stress, dietary issues such as food allergies or sensitivities, or poor eating patterns, antibiotic use, sensitivities to hormones produced in the body, particularly for women, bile acid malabsorption, abnormalities in gastrointestinal secretions and/or digestive muscle contractions or peristalsis. Treatment for IBS is as individual as the symptoms of the disease itself. Each patient will have a different reaction to various foods and medications, so it is important to monitor what does and does not work for you. You might be able to reduce the symptoms of IBS by making certain dietary and lifestyle modifications. Some possibilities include avoiding certain types of carbohydrates, getting enough fiber and liquids, reducing stress, physiotherapy, and consuming specific probiotics or medications. With proper treatment, many patients with IBS can look forward to a significant improvement in their condition. Statistics show that approximately 10% of IBS patients get better each year, although a different 10% will develop the condition, keeping the percentage of people in the population with IBS constant at any given time. IBS remains a condition that can seriously compromise an individual's quality of life, and, regrettably, not everyone with IBS will become symptom-free. In most cases, treatment will be ongoing and individualized. However, IBS is a distinct condition and does not develop into anything else such as cancer, Crohn's disease, or ulcerative colitis.
And that wraps up all about IBS. This brings me to the end of our video. That's all from me today. I hope you guys have enjoyed this video, and if you guys could hit like on this video and turn on notification so when I upload next, you guys get notified, would mean a lot. Also, if you guys could hit the big red button and subscribe to my channel, it would be great. That's all from me today. See you guys in the next video, and peace.